Hello, everyone, and welcome to the Spring Pharmacy Forum presented by the Canadian Foundation for Pharmacy. The topic for today's forum is innovation in harm reduction. I am Linda Pertula, the Executive Director of the Canadian Foundation for Pharmacy. The Canadian Foundation for Pharmacy began in 1945, and it is Canada's only registered national charity for pharmacy, and its mission and in its mission, 6 words, is to help advance the profession of pharmacy. We do that by raising funds for grants awards that our board of directors bestows on deserving researchers, innovators, and leaders in pharmacy. Through our innovation fund, we've granted more than $2 million for 37 research projects, many of which help prove the value of pharmacy service under the expanded scope of practice. Our Wellstream Pharmacy Leadership Award provides pharmacists with up to $10,000 a year in financial aid to foster personal development and leadership. Before we get started, I just wanted to let you know that today's session is being recorded and will be available on our website after the presentation. Also, if you have any questions, please put them in the Q&A section and I will make sure that they're addressed. We could not do presentations like today without donors from individuals and the support of our corporate partners. If you're not already a donor, I'd ask each one of you to consider adding CFP to your personal list of charities. It's an easy and effective way to give back to your profession. I'd also like to say a huge thank you to today's sponsors, our platinum sponsors, our Shoppers Drug Mart and Loblaws, GSK and Amgen. Our gold sponsors are Pfizer, AbbVie, and AstraZeneca. Anyways, that's enough for me for now. I'm thrilled to introduce our first speaker, Jen Belcher. Jen brings over a decade of experience in spanning community and hospital practice settings. She is dedicated in supporting and advancing the profession of pharmacy. In her role as Vice President of Strategic Initiatives and Member Relations at the Ontario Pharmacists Association, Jen spearheads innovative initiatives aimed at enhancing pharmacy services and empowering professionals to thrive in their careers. Drawing from her extensive background in clinical practice, pharmacy operation, and advocacy, she integrates her passion for the outstanding patient care with hands-on experience in implementing initiatives that positively impact their outcomes. So I'm going to turn it over to Jen to talk about naloxone and harm reduction. Jen?
Thanks so much, Linda. When Linda asked if I'd be willing to contribute to this webinar, I was thrilled to do so. It's an area of practice that I feel quite passionately about, having started my career at a pharmacy that had a significant OAT population, and really seeing the impact that the pharmacy professionals can have on the care we provide to not only this population, but also in ensuring that all individuals who may benefit from having access to naloxone in order to provide assistance to someone who may be experiencing an opioid-induced overdose type scenario, to be able to help in those situations. And really over the course of my time in pharmacy, seeing that opportunity that pharmacy professionals have to leverage those close relationships with patients, to build that trust, and to be able to introduce this medication, which does carry significant stigma, in a way that creates greater understanding and acceptance of the intervention. So just before I begin, I am an employee of the Ontario Pharmacists Association. The OPA is an investor in Box Labs, who we'll be hearing from later on today. I personally have no financial investment myself, but I just wanted to share that the OPA is affiliated with Box through a partnership that way. And we have also been looking at ways in which we can collaborate to provide additional support services through the platform to Ontario's patients and pharmacies. I still practice in both community and hospital, but my main role is with the Ontario Pharmacists Association, and I have no other relevant conflicts of interest to disclose. So as we enter, into this conversation, it really brings me back into practice, thinking about, what problem are we looking to address? And we know that the overall awareness of the availability of take-home naloxone kits within Canada is still lower than it needs to be in order to address the need. So with, approximately 1 in 8 Canadians receiving prescription opioids from their prescriber for various different conditions, it is a significant proportion of our population who uses the type of medications or would have the type of medications within a household that could create the risk of an unintentional opioid overdose. And for those of you who may not be pharmacists by trade, naloxone is an exceptionally safe and effective substance which has a higher affinity for the opioid receptors in the central nervous system than the opioid itself does. So basically what it does is if someone is experiencing an overdose situation where they have things like respiratory depression because of that high occupancy of the opioid itself on those opioid receptors. The administration of naloxone is very safe and effective in the sense that the main effect is that it removes the opioid from those receptors and replaces it with itself. And it does that in a very quick manner. When we look at the routes of administration being both injectable and nasal, that onset is very quick, and it can restore normal breathing function to those who are experiencing an opioid overdose and save a life in that way, because it restores that normal respiratory function, cardiorespiratory, and the individual will begin to breathe on their own again. Naloxone is exceptionally safe in the sense that if you administer it to someone who is not actually experiencing an opioid overdose, it will not cause harm to that individual. And, in that, the risk-benefit of analysis of administering it to someone who is unconscious for an unknown reason, but perhaps has some of those other symptoms of opioid overdose, for example, things like pinpoint pupils, slowed, shallow, or not present breathing, blue lips, those sorts of symptoms, that you can be confident that you're not creating a situation where you're unintentionally harming that individual through the administration of the reversal agent in naloxone. So in that, ultimately, the value of having access to these take-home naloxone kits is quite well studied, in the sense that we've seen research to suggest that in areas where there are take-home naloxone programs in effect, it actually reduces the fatalities of opioid-induced overdose by approximately 6-fold. So that's quite significant in those regions where we don't have access to things like take-home naloxone programs. Typically 1 in 20 overdose scenarios will result in a fatality. And that goes down to about 1 in 125, I believe it is, when in locations that do have more prevalent access to take-home naloxone kits, and those that may be poised to respond to overdose have access to these reversal agents in a much more accessible way. And, with that, when we think about naloxone, often we talk about not only its role in reversing overdose from illicit opioids, but really around the pharmacist's role in creating access and awareness for those using prescription opioids. And some of those best practices really are being able to communicate about naloxone in a way that reduces the stigma associated with having access or being in possession of this type of product. Typically, from my own personal practice, you would see resistance to the idea of receiving a naloxone kit because it essentially, people felt that it meant the pharmacist was judging them that they were likely to use opioids inappropriately or in an unsafe way, and or that they were not competent or able to use their opioid properly in a scenario where, especially we have long-term chronic users of prescription opioids. So this is where this opportunity with across Canada, all jurisdictions having access to publicly funded take-home naloxone kits in some way, shape, or form, and the vast majority of provinces and territories having pharmacy-based distribution programs, where this opportunity for pharmacists and all members of the pharmacy team to normalize the dispensing of naloxone kits to individuals that may have opioids within the household, or really anyone who might be in a scenario where they could have that potential to respond to an opioid overdose situation. So this is where, as a parent, I think a lot about, what my child's, the reality of, growing up in a culture where there is much more prevalent recreational drug use, even of traditional prescriptions. And while, myself or my child may not be, either therapeutic or recreational users of substances, would any of us be in a scenario where we might have to respond? And this, in thinking about some of those communication strategies, how do we position that with people where, we think about other interventions that are intended to respond to emergencies that you hope to never have to use. I don't keep a fire extinguisher within my household because I expect to perform arson myself and burn my house down. But boy, am I sure glad to have it if some emergency scenario that I could not anticipate were to arise, but I now have the means in which to address it to reduce the harm in that scenario. I don't wear my seatbelt in order, because I expect to get into a car accident. So, these sorts of conversations where we can begin to reduce that stigma associated with receiving or, being dispensed a naloxone kit, and really look at it as more of a positive intervention, that people are taking proactive measures to ensure that they have the ability to respond to an emergency scenario, just like they may keep a first aid kit, a fire extinguisher, or other, emergency type supplies within their household. And I think to sort of share an actual case that I had in my practice, I was a couple years in, and it really sort of, drove home the reality that it may not just be individuals who receive opioid prescriptions themselves that would benefit from access, and the presence of naloxone within their sphere of influence. But I had a patient who had a young child at home. I think the child was 18 months, and obviously anyone who's had an 18-month-old knows how mobile and how curious they are. But this individual did not use prescription opioids herself, but had someone over at their home who did, and who took a dose of hydromorphcontin, 24 milligrams, while she was at her home. And unfortunately, what had happened was, on opening the vial, another one of the capsules had fallen out of that prescription vial and then onto the floor. To the best of my patient's knowledge, what had happened was that when she was sweeping her floors, she might have swept it into a broom closet or something along those lines. She had a cat. The cat likes to bat things around, and found this capsule in the closet and was playing with it. And the 18-month-old, obviously interested in what the cat was doing and the brightly colored capsule, reached down, picked it up, put it in his mouth. Fortunately, my patient saw this happen. And anytime you see your child put something that, you don't know what it is, and an animal's been playing with into their mouth, you typically, are looking to investigate. And so she did do a mouth sweep. At that point, the capsule had partially disintegrated, and so some of the granules had come out of the capsule. She immediately took the child to hospital, and he spent a couple of days in the PICU, but ended up fine. But she didn't have a naloxone kit in her home because she wasn't anticipating to ever need it. She didn't have opioids in the house. But I think the key there was, really, when she came in to ask, hey, what are these naloxone kits? Could I administer it to an 18-month-old? Like, would I need to change the dose? Like, what would I need to do? But like, I never want to be in this scenario where there was something that I could have done and I just wasn't prepared to do it because I either didn't have the supplies or I didn't know how to use it. So that education and that awareness that with the high prevalence of opioid use, both prescription and recreational, especially in some of these social scenarios, there is that opportunity to be in a scenario where you may need to help somebody without that expectation. So communicating that to any and all patients and being able to talk about these scenarios where, by no fault of her own, she was in that scenario. It really, sort of drove home to me the importance of being aware that these are available and having those conversations with so many of our patients that it really truly does normalize and create that overall awareness, because we're not in a scenario where we see the majority of pharmacies dispensing naloxone, or I think we are in the majority now, but it's not a high enough prevalence of pharmacies in the Canadian setting that provide this service. And even then still, most, for those pharmacies that do dispense, typically there are a small subgroup of pharmacies that dispense the most naloxone. It's typically primarily focused at that harm reduction population in the OAT space. But we know, especially with elderly patients who may not have completely stable kidney or liver function, we're not entirely sure of things like metabolism, changes to those sorts of organ systems that clear opioids from the system, changes in behaviors or levels of pain, things like opioid rotation, new or changing doses of opioids. There are a lot of opportunities to introduce the need to perhaps have naloxone on hand, not because of an intentional overdose or because of inappropriate use of opioids, but because, of course, this is a measure that we put in place to respond to unexpected situations. And naloxone isn't a drug that you typically would administer to yourself. In most of the cases where you end up needing it, it needs to be administered to that individual. So ensuring that, while you may have that conversation with the patient, that they understand the importance of communicating to those in their household, to being able to have more of that education across people who may need to provide this type of care to an individual. And so with that, understanding that the pharmacy practice environment is exceptionally challenging, it's really exciting to see programs and services that assist with this type of proactive communication and outreach to patients. And OK is very proud to partner with Box Labs in providing some of that support through our call center to some of the patients that Mike will talk about later. But just sort of before I turn it over to back to Linda to introduce Michael, I just wanted to take an opportunity for to talk about CFP's national services chart, which does include information, as you'll see here on the left-hand side, around opioid harm reduction programs, what programs exist, and what funding is there for pharmacies through those provincial public programs in every jurisdiction. So this is just a quick snapshot from that chart where we see Ontario in the left column and Quebec on the right-hand column. but it's an absolutely phenomenal resource, not just in the harm reduction space, but for anyone who is interested in what types of services are available, enabled, and funded across the country. And I think Caroline will put the link to the PDF of this document in the chat. And it's recently been updated. It is maintained and is, I think, Linda said, the centerfold in the magazine that's produced. So I would highly encourage everyone to bookmark that link, download a copy, but because it's continuously updated, to have that link on hand, because especially in our work with the Ontario Pharmacists Association, the opportunity to access this information for things like jurisdictional scans and, in our advocacy is really invaluable. And we have seen just recent changes to our Ontario program that provided greater clarification that things like the dispensing and the education of the patient and training on the kit had to be provided in that in-person setting, and that the program is really not intended to be providing kits through to businesses. And that was a part of that recent update in our executive officer's notice. But keeping in mind that we have a national audience here, I think it's really valuable to see, across the country, what types of programs are available. So when pharmacies are looking at what they can do to promote this really valuable service and product to their community, to have that awareness of, if you do have patients that are, mobile, that perhaps some are in different jurisdictions, how they might be able to access those types of kits, because of course, with any product, there are things like expiry dates to keep in mind, ensuring that, when we think about patients, it's not just a one-time dispense with naloxone kits. We may need to provide replacements as products expire, or of course, if they've had to be used in replacing those kits. So just that awareness overall of what our national, scope, service availability and funding structure is. And, where available, oftentimes too, CFP will provide that utilization data right in the chart, which is really fantastic. So just sort of shameless plug for their services chart, because we find it exceptionally valuable. And I hope that everyone on the call does as well for their own role. But just, in summary, it's such an exceptionally important service. The opportunity to save a life and to reduce this type of harm and impact, on somebody's overall trajectory of their health and life is exceptionally meaningful. And the role that pharmacy can play is such an important and, not yet fully utilized one, that looking at all of these different ways in which we can make the operationalization of these types of services easier, more efficient, and more consistent to be able to provide that greater reach is truly critical at this juncture in our practice. So thanks for that. And Linda, I'll turn it back over to you to introduce Michael, but happy to answer any questions at the end of the presentation if anyone has any for me.
Thank you so much, Jen. That was a great overview on the importance of naloxone in community pharmacy. And I have to also thank you for the plug for the CFP services chart. So if you want a copy of the chart, the link isn't up yet, but you can always go to cfpnet.ca on our website and you can download the chart there. It is my pleasure now to introduce our next speaker, Michael Damian. Michael is a second-generation pharmacist with a rich background in healthcare and innovation. With an academic foundation in engineering from Queen's University, he has navigated diverse roles within the pharmacy industry, working in both chain pharmacies to starting and managing his own in both the US and Canada. His experience has shaped the vision for a better industry, leading to the creation of Box Labs, a cloud-based pharmacy management system aimed at revolutionizing the field. It's over to you, Michael. Thank you.
Thank you, Linda. I appreciate the opportunity to be featured and to be a speaker here. I guess I'll tell you a little bit about myself and why this is an important thing to me, specifically around naloxone. So besides, kind of what Linda mentioned, most of my experience in the pharmacy space has been in opioid heavy pharmacies. So I've worked in pharmacies that, are heavy dispensers of methadone and Suboxone. And I've kind of seen firsthand the the negative implications when Narcan or naloxone isn't available and readily utilized. I've seen many close patients of mine kind of pass away, and a lot of preventable deaths and illnesses just because Narcan and naloxone wasn't readily available. I'm very excited again to be here. And I'm going to start off kind of, echoing what Jen mentioned around like why this is important, why this is a problem. These are some quick stats from 2023 around how many deaths per day are attributed to opioid overdose. And it works out to about 20 deaths per day. Pharmacists, as we kind of all know on this call, are imperative to assisting and making sure that that number goes down significantly, as we are frontline in the healthcare industry, and we are the most accessible healthcare professional. It's very important that, one, we raise awareness of the services that we're able to provide to our patients, and second, that we, not just make our patients aware, but also provide these services in an efficient manner and really help them understand and see where the value is in pharmacy and in the services that we can provide. So, in terms of opioids specifically, one of the stats that I was most surprised to hear is only about 5 to 6% of opioid users have access to Narcan, and less than 1% of opioid users or patients that should have a Narcan or naloxone kit at home actually have one. This was surprising to me just because this is something that is really accessible and should be really accessible and is available at every pharmacy across the nation. Yet it's still something that is not as utilized as it should be. Jen kind of highlighted some of the reasons why, the stigma associated with it, and why a lot of patients and even pharmacists are coy when making recommendations for Narcan or naloxone, only because they're concerned about offending their patients and them understanding it to be something that it's not. And Jen kind of made the relationship to say that Narcan is like having it's just a precaution. I like to make it akin to having an EpiPen in your home. You don't ever want to use it, but you're glad it's there if need be. So that's kind of when developing this program to kind of highlight and increase the distribution. That was something that was really important for us to really consider, is not only identifying the opportunities, but also making sure that the communication with the patients is done in a way where Narcan is seen, or Narcan naloxone is seen for what it is, in that it's a in case of emergency medication that anyone with an opioid in their home should really have on hand, regardless of whether they're a chronic opioid user or an opioid user at all. And Jen kind of highlighted one of the examples that happened with her personally, and then that was of no fault of the opioid user in the home. And that's something that can really happen to anybody. So I'll talk a little bit about plan and where it comes in. So really our goal here was really simple. Our goal was to increase the distribution nationally of Narcan and naloxone and making it more accessible at the pharmacy level. So we do this in a variety of different ways through the platform, through Box Labs. The first is we identify opportunities. So the first step in any of these kind of types of programs is first make sure you can see which of your patients qualify and which of your patients would benefit most from getting a Narcan naloxone kit. And then the second step is making sure that we're able to bill and document appropriately. So a lot of the times the different available options that pharmacists have for clinical interventions, a lot of them aren't being done just because of lack of documentation. Pharmacists are concerned that they will go through and complete the billing and then have ODB or some other auditor on their door, and they've missed a check mark somewhere, or if they've done something, they haven't completed the documentation appropriately, and then a lot of that work is wasted effort, at least financially. And so it was very important to us, really knowing firsthand how busy pharmacists are, and how kind of these types of documentations can really discourage pharmacists from completing these interventions, that we make this as seamless and easy as possible for pharmacists and pharmacies to complete. And then lastly, and this kind of goes hand in hand with the documentation and the delivery, we wanted to make sure that the training and the delivery was able to be documented, and that there was a place for, from beginning to end, where the process can be in one system, one solution, without having to go back and forth with multiple different softwares. So what we've kind of developed for pharmacy is kind of a two-pronged approach. So we kind of understand that pharmacists and pharmacies are quite busy, and because of that, we offered an option to pharmacists where almost all of the work did not fall on them. So in the second option that you see there, where it costs $6 per kit, the pharmacist really, the Box Labs was really in charge of identifying patients. We would contact the eligible patients via SMS text. We even complete the billing for the pharmacy, and we advise the pharmacy of the the patients that are coming to their store to pick up the kit and receive the in-person training. So that's really where a lot of the success of the program lies. And that is really because, like I mentioned earlier, pharmacists are busy, and this is a lot of the times just one additional thing that happens to get missed. And then, of course, if pharmacists wanted to complete the service themselves and with the utilization of our software, essentially they can do all of these steps, all the way from identifying to delivering the medication directly from the platform, without having any interventions from any Box Labs staff whatsoever. So those were kind of the two ways that we went about it. In terms of within the platform itself, we look to identify patients both retroactively and proactively. So when a patient comes to your pharmacy and is picking up an opioid prescription, we will have an alert at the point of sale to notify the pharmacist that this individual could qualify to receive a Narcan or naloxone kit. And then the pharmacist or the tech would call over the pharmacist and advise if this is a situation where the pharmacist thought it was warranted to provide them with a Narcan or naloxone kit. So that's the proactive approach, and that's the approach that we try to really encourage all the users of our software to use moving forward. But one of the solutions that we really also wanted to tackle was retroactive patients. So that's patients in the last 3 to 6 months that have received opioid kits and were missed, so they didn't get a Narcan or naloxone kit. And so those patients right now, what we're doing is we're offering pharmacists the opportunity to contact them via SMS text message. And I'll go through kind of the communication and how the text is worded, because that was, a very important part of kind of developing this program. So to go over the options one more time. So option one was we identify, so the pharmacy would identify eligible patients. They would use the Box Labs platform to do this. Right now, the way that we identify eligibility is patients who have received an opioid prescription in the past year, but have not received a Narcan kit in that past year. There are opportunities to widen that eligibility criteria to include other patients, as was highlighted by Jen. A lot of, it could be a family member of an opioid user, etc. But that is not, information or data that we have access to. And so, we tried to focus on the patients that we thought would benefit most from these from Narcan. So that's essentially how we're doing it at the moment. We also built into the platform have the ability to bill government payer directly. So that means that the pharmacist doesn't have to go back and forth with their main dispensing platform in order to bill, package, print the label, etc. Distribution, I think, a lot of us on this call know, recently there was a change in terms of how distribution had to occur. So we obviously modified our program to kind of make sure that we complied with the new regulation for making sure that all distribution was on site. So after it's billed and packaged, it goes into another queue, and then the pharmacist will see these are the 10 patients that they need to distribute the Narcan and naloxone to. The way that we also, when we're sending out these text messages, the patients that we're targeting are always patients that are due to pick up prescriptions in the next week or two. So we have an additional option for the pharmacist to filter when their next regular prescription pickup is, and then that way they're not having to make a special trip to the pharmacy to get their Narcan and naloxone, but they're able to get it when they're picking up their prescription. Training, we provide training documentation to the pharmacist at the store level, and we kind of instruct them as to how they would go about training, and we provide them the materials to do so, and we provide them the ability to document the training that's being done in the software. So option 2 is really very similar to option 1. The biggest difference is the first 2 steps are done completely by Box Lab staff. So because we're a cloud-based software, our staff can have access to your pharmacy's data if you would like us to, and we could use that to help you kind of complete these interactions and complete these whether it comes to Narcan or other services that we're looking at doing down the line. We can try to take a lot of the burden off the pharmacist in the store, or the technicians in the store, and try to help wherever we can. So that's really what we're doing in option 2. That's different from option 1. The distribution and the training is largely very similar. We do notify the pharmacy when there is Narcan kits that need to be distributed, so that they can pay attention to look in that queue within the software to make sure that they can see where that is. They can get that taken care of. The text message. So we went through several iterations of the text that goes out. This was really important because we wanted to make sure that the text was not, did not come across as being, condescending or was not taken in a way that wasn't intended to take it. Keeping in mind that Narcan and naloxone should really be in every household that has any opioid prescription within that household, whether or not it's not only indicated for the opioid user themselves, but for anyone in that household. So we tried to really word that text in that kind of way. And the way that we went about it is we did our first iteration, and we would send it out to only 50 patients. And then we would follow up with phone calls to some of those patients and ask them how they found the text, and whether or not it was well received. And obviously we could tell by the responses that we were receiving whether or not there was any issues or any positive or negative feedback around the wording of the text. You'll notice that the text message allows them to respond. So they can respond yes or no, but we also give them the ability to respond in free form. So if they respond free form, it also goes into a separate queue, and they can then be contacted directly with their pharmacy. We also, in the latest version of the text, include a toll-free number for the patient to call if they have questions around the program or Narcan itself. And that is not intended to be a substitute for the training, but is intended to be an adjunct. So if somebody receives this text and they're looking at it and they're not sure what's going on, they would then be able to contact that number and kind of get an explanation of the program and why it exists. The person on the other line, on the other side of that call, does not have access to any of their specific patient information. So this would only be really intended for general questions. We found that after including that 1844 number, that the response has been a lot more positive in terms of the patients that are actually responding yes. One of the constraints that we had is just the number of characters that we can make a text is limited. So we wanted to make sure that we captured all the relevant information, but that it wasn't so long that it that it was either getting denied by the carrier or The patients sometimes when they see a really long message, they assume it's a marketing message and they may not engage with it or read it. So that was really like kind of instrumental to the success of the program. So right now we started this program early January, so kind of right after the new year there. And it's been quite successful. We've enrolled about 104 pharmacies into the program. And you kind of see the stats there. We've dispensed almost 2,000, or these pharmacies have dispensed almost 2,000 Narcan kits since the inception of the program in January. We're really happy to see that. When we compare that to the baseline, the 3 months before that, it's quite a significant increase. It's approximately, I have to pull up the data, but the same period last year, the number of dispensed Narcan kits was less than 500 for all of those pharmacies combined. So it's quite a significant increase in terms of the success and what we were kind of able to achieve. One of the kind of closing remarks that I'll have before I turn it kind of over to Kiro is just trying to think about how else we can help pharmacists. So this is just an example of a program that we rolled out with the specific goal of increasing the distribution of Narcan, naloxone across Ontario and Canada. Similarly, there are many other programs, and I think Jen touched on a lot of the other ones that could provide value for for patients in Ontario and across Canada. This being just one of them. There's a lot of very similar other ones that we're excited to endeavor upon looking on with the OPA and other stakeholders. With that being said, I'm going to turn it over to Kiro, and I'll let Linda kind of introduce him.
Thank you, Michael. That was really, really informative. I have a question here. It says, is Narcan nasal spray publicly funded? And then I would say that would probably be nationally. They wanted the McKesson number, but I don't know if any of you guys have it offhand.
It is publicly funded, and I can get the McKesson number. Maybe while Kiro's giving his talk, I can look it up and I can provide it at the end of the call.
Perfect. Thank you so much. So now it is my pleasure to introduce the final speaker for today, Kiro Masai. Kiro is a community pharmacist and the owner of Lawlor Pharmacy in Toronto, and is dedicated in advancing mental health and addiction awareness. With advanced studies in psychopharmacology, he brings valuable experience to his work. Kiro is recognized for his public speaking engagement, featured in several new outlets and radio shows. In 2019, he was honored with the CMHA Award for founding #EndTheCrisis, an initiative empowering pharmacists to educate patients, parents, and students about mental health and addiction. It's my pleasure to hand it over to you, Kiro.
Thank you very much, Linda. So I think that there's probably quite a bit of questions that people probably have by now, so I'll try to keep it brief. Disclosure for starters, I'm a spokesperson for Box Labs, but I'm also a user of Box Labs in my pharmacy. So as mentioned, I'm the owner of Lawlor Pharmacy located in Toronto Beaches, and we've been using Box Labs as a POS as well as for expanded services in the pharmacy. And I have a bit of a unique story. It's somewhat similar to Jen's, except it did not have such a fortunate outcome. I had about a year into my career, starting my career, I had a patient that came in. She was a regular, and she was a really good lady. She was about 67 years old, roughly, and she never took opioids herself. And she was just weeping. And I've said the story several times in my presentations before, but some of you may not have heard. She was just crying. I took her aside in the pharmacy, and I remember her saying, "He didn't wake up." I said, "Who didn't wake up?" "My son, he didn't wake up this morning." I passed by his room. He's visiting from Vancouver and he didn't wake up. I tried to wake him up. He wouldn't wake up. I called an ambulance. I called fire, police, everyone came. They couldn't get him back up. He passed away. And I just kept hugging her and calming her down. And then suddenly she pulled out 3 empty capsule shells, or it was a bunch of empty capsule shells. I'll never forget them. Our hydromorph content 6 milligrams. And they were open and they're empty. And she asked me, I found these in his bag. Do you think these had anything to do with it? And obviously, as the pharmacist listening in, you know that hydromorph content, you're not supposed to pull it out of its capsules. And if you did, then there's a high probability that you're misusing it. I told her you may want to show these to the police. And she just kept crying and saying, I wish somebody warned him. I wish somebody warned him. I wish somebody warned him. And like that night, it just kept playing over and over in my head. And so I found it in the crisis. It started with me just kind of talking to local schools, and then other pharmacists kind of took up arms as well. And they spoke to their own communities about addiction and made their own format of it, where they would just speak to the general public, parents, patients about opioids and addiction in general. And I think that it's very important to start people early when it comes to education and informing them about the mechanism of addiction, not just opioids, because that is a public service. And I think that that's a very valuable public service that pharmacists can bring. And they have the knowledge and the know-how on how to do this, actually. Because let's face it, you're doing it every single day at work. You're speaking to tens of people in a single day, and you're explaining different things in a relatively simple fashion. So I would encourage others to just follow suit with this and do their own versions of it, protect their communities in the best way that they can. So when Box Labs kind of was introduced to me, and I saw this, this, I guess, path to distribute Narcan kits, I felt that this was something that was very needed, because a lot of my patients don't know what a Narcan kit is, and those who may know don't necessarily know that it's publicly funded and they can just have one on hand. So I had options. I obviously had the option of calling every single patient I had in the pharmacy and letting them know, hey, there's Narcan kits, and going through the entire list of patients. I also had the option of, I guess, putting targets for my staff to talk to as many patients as possible in a single day about Narcan kits. Or the option that I ended up opting for was to disseminate the message as widely as possible using Box through these text messages. And that was quite successful, I would say, in my pharmacy. So we went with the option of texting. It was, I believe, in the last, all the patients that have dispensed opioids in the pharmacy in the last 3 months. And it was a personalized message, because my pharmacy, if you know anything about Lawler Pharmacy, we're very personal and kind of in your life kind of people. We're a bit strange in the way that we operate. So I didn't want it to seem spammy. I didn't want it to seem generic. I wrote my own message. I mentioned to them, hey, this is Kiro. I'm your pharmacist at Lawler Pharmacy. I just wanted you to know that as part of our I guess, community protection initiatives that we have here, we're distributing Narcan kits to patients that wish to get them. If you would like one, it could save a life for someone that overdoses on opioids. You can press yes or no, and that was how we got the message across. It was very automated, very seamless. It happened with a few clicks of a button, and it took no time and no effort from our end. And some of the people that opted in, it kind of surprised me. a lot of them were younger. And a lot of them weren't on any heavy opioids. And I found that to be quite interesting. And we had one that called after the text happened and said, my mother got a text message about this. I'm going on my bachelor party in a few weeks. I would like a Narcan kit as well to keep on hand. So I actually applauded that person a lot because that's a very responsible thing to do. You never know what could happen at one of these functions. And so we simply disseminated the message. We ended up with a nice list of people that consented to receiving the naloxone kit. Nothing spammy. We didn't push it on people. We didn't have any sort of target, if you will, when it came to this. It was an opt-in, opt-out. And if you opted out, you're not bombarded with more messages about this again. You're put on a list where you won't be notified about this again. And it was a case of identifying the patient that was eligible. Box did that, and then afterwards communicating it, and then the billing piece, you were able to adjudicate it straight from the actual point of sale or the actual solution, which is Box, by just clicking a button, and it would use the health card of the patient that's already there. It's billed, and then you have this list of people that you billed for. You're ordering just for them the actual Narcan kits, and then you're calling the next day to arrange for a time to have the education session with them and distribute it to them. And it, you know, in a single week, we were able to distribute more naloxone kits than we did in the last year, because it's a lot easier to communicate and convey the message if it's an automated fashion to the right people that actually wish to have an naloxone kit, rather than just cold calling or bombarding people with messaging that they may not be interested in. And moving forward, our hope is that we will be able to use that functionality that Michael was just mentioning, where we would have a pop-up that at the point of sale, that when a patient is picking up an opioid, we're able to have that dialogue, or the assistant would then call the pharmacist over to speak to the patient about naloxone kit. And if they opt out and they don't wish to discuss it, they don't feel that this is pertinent to them, that's fine. In the future, I'm also going to be messaging this or sending this out to all patients above the age of 18, not just ones that used opioids, because a lot of the patients that came to me over the last year were people that never used opioids, don't have opioids at home, but they're just parents. And I don't use opioids. I don't have any in my house that uses opioids, but you know, I need to have one on hand just in case. It's, again, they all mentioned the case of the fire extinguisher and, you know, all those things that you have at home and hope you never use. In my case, you know, I train in boxing and Muay Thai, and people always tell me, you think you're ever going to get in a fight? I pray to God I never do, and I'll do my best to never get in one. But if you're in a situation where it's life or death, you have to have the tools to choose life and to be able to protect somebody or to save somebody's life. And that's why a lot of people are opting in or are wishing to have this on hand. It's just a matter of knowing if it's available or not in many cases. And I think that this tool, Box Labs, is able to disseminate that message, let people know about the availability of the product, what it is for, and then patients then are free to opt in and have it on hand or not. And it's based on their own risk assessment. Again, some of these patients are younger. They had like one that just had Tylenol 2 after a dental procedure, so the algorithm just texted them. But their lifestyle or the people that they hang around with, based on, you know, their own risk assessment, they feel they need to have this on hand. So it's our job just to notify the patient And then they may choose to opt in or opt out. And so far, we've had pretty good feedback. And the fact that they can completely opt out of the text messaging it made patients feel at ease. And they haven't had anybody call back and have an angry phone call, because that was a concern that I had initially. And thankfully, that hasn't been the case. But overall, I feel that so far it has served its purpose, and we're delivering the service to the people that require it. And I feel that this is what's needed to protect the community at large. So I think that leaves me with, I guess, turning the mic over. And if anybody has any questions, they may go ahead with it. So Linda, I leave it to you.
Perfectly. Thank you so much. That was a fantastic presentation from all three of you. Carrie, your passion for pharmacy is outstanding. Just before we go for the day, I just wanted to thank once again our sponsors. Without them, we could not do programs like this. And I'm just trying to figure out how we get the sponsors back up. There we go. Our platinum sponsors today, Shoppers Drug Mart and Loblaws. Our gold sponsors, Amgen, or platinum, sorry, GSK and Amgen are also platinum sponsors. And our gold sponsors, Pfizer, AbbVie, and AstraZeneca. I hope you all enjoyed today's presentation. And this, as I said, oh, we have another chat here. What's on the, sorry, let me just see. Sorry, just to let me know if the questions have been answered. Sorry about that. I want to thank you all for joining us today. That website at the bottom there will also get you to our pharmacy services chart. And please sign up for our newsletter and get the latest on our research and everything else that CFP is doing. Just as a teaser, our next event will be on April 4th at the Innovation Showcase. Details will be following in the next few weeks. Thank you and have a wonderful afternoon, everybody.